So last year's home health wage index, there were some changes in there that caught a lot of providers, I'll say, off guard. When you look at hospice today, what signals in that home health wage index that maybe you believe a similar recalibration is coming for hospice?
One thing that I think that we need to be very cautious about is thinking that the headline of the wage index is really what we need to be focused on as leaders. You know what? They're not going to take that time with hospice, guys. You need to be prepared that it's going to happen very, very quickly. I will be surprised. I don't have a crystal ball, but I will be surprised if we don't have some kind of value-based care by 2030.
The whole per diem system has set up some profiteering that has just been proliferative over our industry. And so this is another opportunity that now, you have to be there. You have to show up. You have to show that you've managed symptoms, and there's accountability around being a hospice provider.
One of my big fears from the beginning as a nurse myself, and a nurse for many, many years, and working with a lot of different hospice nurses across the board, my concern was the underrating of symptom impact to avoid creation of the HUV. And I think that CMS loves it when we provide incomplete and poor data, because it gives them an opportunity to make changes that are not always in the benefit of the industry.
22 years ago, I had one piece of paper to do my physical assessment on, and admission was a trifold. People are dying the same way they were 22 years ago. Their meds that we're using and how we're doing it are pretty similar, but we have complicated this so much at the point of care, and we want them to do more and more. And how many fire extinguishers and this and that. We're really the OGs on taking risks when you look at hospice, because we were given, let's just make it up, $4,000 a month to care for somebody. And you take them on, and then they may add treatments to their plan of care that are beyond that $4,000. We're managing risk all the time. It's exciting and terrifying in the same sentence, but I think it's necessary, and we're in this together.
We created a beautiful model of care. We have to talk about it differently so they realize, like, what I'm thinking is listening to you two is we need to create the Whole Foods brand, that they realize this is the best of the best, but when it comes to serious illness care, this is the type of organization you need to get care from. We need to do that for the seriously ill space.